How IOP is linked with the pressure in the central retinal artery or the blood pressure in the central retinal artery. It is 3rd of January and time is 6 to 8 p.m. So in this video we'll discuss a key concept, that how central retinal artery can be affected with the eye pressure and how the pressures can be checked. The normal pressure inside the eye, if we measure it with different method, should be between 15 to 20 millimeter of mercury. But how it is a lower IOP pressure or a lower pressure is considered when it is less than 8 millimeter of mercury. It is known as hypotony, or there are other definitions of hypotony as well. And the higher pressures above 20, they can go up as high as 20 millimeter of mercury to up till 40 and above. They are known as higher IOPs. How they can affect the central retinal artery. So what we know from the science of central retinal artery, when the heart contracts, that is systole, the lumen of the central retinal artery collapses, and for that time the blood supply to the retina is for the momentarily stopped, and as it goes, as the heart goes in diastole, the lumen of the central retinal artery collapses again. So this is a brief collapse during systole and diastole, and IOP should be within normal range. If the IOP is too low, that is less than 8, or too high, that is above 20 or more, this collapsed form of the central retinal artery will remain prolonged. The collapse of central retinal artery is prolonged, leading to the decreased blood supply to the retina and leading to damage to the retina or decrease in vision. So this is a very key and minute and delicate concept which should be learned. And usually the glaucoma patients ask, like a patient comes after a trap surgery whose vision was decreasing, and he undergone a trabeculectomy. That is a procedure done for lowering of the IOP, but his IOP went too low due to a surgery, surgical error due to overfiltration or underproduction. So many things can go wrong in a surgery. So how the lower IOP will affect the vision? The patient can come with the complaint that his vision has dropped suddenly after the surgery due to lower IOP. The mechanism involved is most probably this we just discussed. And on the opposite side, if a sudden rise of IOP or a gradual rise of IOP usually lead to decreased blood supply to the retina, and those decrease in blood supply to the retina leads to gradual damage of the axons or neural tissue, neural retinal rim of the optic disc. If it is sustained high pressure, it will have a mechanical aspect as well, leading to the optic nerve damage. So I wanted to convey this key concept, how the retinal blood vessels decrease the blood flow to the retina if our IOP is too low or too high.